Hello and welcome to this special broadcast of Facts versus Myths on the corona epidemic or the pandemic which is affecting the world and also our country. I'm Amritpal Singh. We'll give you the exact situation which is arising out of the prevailing corona pandemic which has affected the whole world. But we'll also appeal to you not to panic but also take the requisite measures to prevent it. And over the next 30 minutes, we'll be taking questions from you so that you can get accurate information about the coronavirus outbreak. To answer your queries, I have with me two special guests in the studio to bust the myths about coronavirus and give you some facts so that you can know what it takes to be safe, but that's without panicking and falling prey to the rumor mills. Our telephone lines are now open. You can call on these numbers. Our numbers are 02309 7663 0112338. What you see on your screens, let me tell you that to give you first let me bring you back the telephone lines. The telephone lines are 011 2309 7620. The code is Delhi. 011. In case you are calling out from outside India, then you can prefix +91 or dial 0091. These numbers flashing on your television sets right now are the numbers you can call over the next half hour. I have with me Dr. Rajneesh Kaushik. He is the ICU in charge at for Karuna at the RML Hospital. Also, I have with me Dr. Tanmay Talukdar. He's a professor of the respiratory medicine at the Lady Hardinge Medical College in Delhi. Both gentlemen, many thanks for joining us. We'll get straight into the show, but before that, let me give you what the exact situation in the country as of now is. As of today, as of Thursday evening, the total number of active coronavirus cases in India has risen to 149, including 25 foreign nationals. 149 active cases are there. One case each has been recorded from Andhra Pradesh, Odisha, Punjab, Uttarakhand, Puducherry and West Bengal on Thursday. The highest number of confirmed cases in the country have been recorded from the state of Maharashtra. Maharashtra has the highest number of cases. 45 confirmed cases have been recorded from Maharashtra, and a total number of 19 persons till now who were found infected have recovered and they have been discharged. 4 deaths have taken place till now. Till Thursday evening, 4 deaths have taken place. To contain the spread of infection, the government has issued instructions for staggering working hours and to draw rosters for 50% of the staff to work from home on alternate weeks till the 4th of next month. That means till the 4th of April, for 50% staff of government offices has to be rostered and can work from home. The central government has also asked all ministries to install thermal scanners in government buildings. In fact, they've been installed. All gyms, recreation centers, creches in government buildings have been closed. Ministries have been asked to discourage entry of visitors to government offices. Visitors and temporary passes have been stopped with immediate effect. Most corporate sector has given work from home to people where they can. The government has advised the corporate sector to go in for that. The Prime Minister, Mr. Narendra Modi, will be addressing the nation shortly on the coronavirus outbreak in the country. He'll be doing that tonight at 8 o'clock. That means in about 20 minutes from now, the Prime Minister will be addressing the nation. During his address, the Prime Minister will talk about issues related to COVID-19 and efforts to combat it. Earlier on Wednesday, Prime Minister Narendra Modi had chaired a high-level meeting to review the ongoing efforts to contain COVID-19. So the Prime Minister will be addressing the nation in a short while from now on Thursday evening and shall be talking directly to the nation. We'll have to wait and see what the Prime Minister has to say. But the idea is not to panic. You can call in on the numbers that you see on your screens. We have our first caller. Anand from Bangalore is calling us. Anand, please go ahead and ask your question. Anand, I will request you to switch off your television set or lower its volume at least and ask your question into the phone.
Yeah, I would like to know, I'm running a yoga center.
Okay.
Okay, okay. I'll switch off the volume. I'd like to know if I can run the yoga center where I have 15 people coming in a batch.
You run a yoga center and you want to know if
sanitizer, not more than 15 or 16 people come.
Okay.
Is it safe to run the yoga center?
Okay. All right. I'll let my experts answer that. Dr. Talukdar, he runs a yoga center where not more than 15 to 16 people in a batch come. If they use hand sanitizers, should he discontinue that? Should he go ahead with that?
Anand, firstly, congratulations for running a good yoga center with 16 people coming in there. You're doing a good job. But I would like to request you that as far as the advisories are concerned, since you are gathering 15-16 people, it is recommended, strongly advised that till the next guidelines come up, you please do not gather so many people together, and this is what we have to do. And also I would like to also request the people who are running smaller centers to do periodic cleaning of their places. So answer to Anand's question is, we should not be having so many people coming together. So any such gathering is it's supposed to be not performed now. And also when even for smaller gatherings or households or small offices, it is recommended that we clean all the surfaces which we touch. Now we have to say by clean by what? By using sodium hypochlorite solution 1%, the common household bleach, and we have to do it on the surfaces which are commonly touched. For example, our anchor is touching the laptop right now, so that's that surface, the door knob, the tabletop, okay, that has to be cleaned 3 to 4 times a day with this solution, and also floor has to be mopped twice a day. But as far as a gathering of 16 or more people, probably it is advisable not to make such gatherings.
Dr. Rajneesh Kaushik, are there smaller groups that can come in? If there is a smaller group, if Anand wants to go in for say 5-6 people, is there a particular age group that he should look at that can come in, or would you recommend that he does not run it for the moment at all?
Ideally, as per the advisory, even the smaller groups are not advised. And regarding the age group, the age people who are above 65 and who are less than 10 years, they are more prone for the infection, and the complication of the infections. They are not advised. Also for the people aged from 10 to 64, the advisory is you should avoid any gathering, any social, any public gathering should be avoided.
Okay, you're saying the advisory says that people below 10 years and above 64 or 65 should not go out at all, and people from 10 to 65 age group should not go into any sort of gathering.
Other groups includes the pregnant females and the people who are on the other, who have other disease and who are on the other treatments like hypertension, diabetes. These people are also at the high risk of getting the disease and more complications.
All right. So Anand, you come from Bangalore, you're calling from Bangalore, the technology hub of India. I would suggest if you can use technology, you can give your yoga sessions through laptops or social media where people can sit in their homes and still continue with the yoga classes. That would be a good idea to go ahead. I hope your question is answered. We also have a caller from Hyderabad. Mr. Murlidhar is calling from Hyderabad. Mr. Murlidhar, please go ahead and ask your question. Mr. Murlidhar, are you on the line? Mr. Murlidhar, if you can hear me, please go ahead and ask your question. I think we've lost the line with Mr. Murlidhar. Dr. Talukdar, if we could, for the benefit of our viewers, that's the reason why we're running this show, this special broadcast. If you could reiterate what is the basic hygiene measures that people need to take care of where we are right now. As we said, 149 active Corona infected persons in the country right now, people in the country right now. 19 have been treated and discharged. 4 have actually died. What is that we as a nation need to do right now? What as we as people should do right now?
Firstly, we need not panic, because this is not worth panicking for. It is time to act. And how do we act? By following the recommendations and the guidelines. And the recommendations are very, very simple. We have to just not get out in the crowd. We have to stay where we are. If we are working, our office would permit us either working on alternate days, or the work schedule can be staggered, or even work from home. Apart from that, those who we have again and again said, the people who are at risk should always remain indoors. This is the first thing we have to do. So we have to be prepared. The idea is to be ready if at all we face the challenge. Right. Apart from that, what are the basic hygiene? We have been saying that again and again, and I'm sure our audience already knows that. But for the sake of repetition, yes, we have to clean our hands, because the disease spreads through these, either the fomites which is on the surface, or by the droplets, and at the end our hands play a crucial role in giving us the infection when we touch our eyes, nose or mouth. So one, we should not touch our eyes, nose or mouth without washing our hands. Secondly, how we wash our hands, we have again and again insisted and we have told. But one fact I'd like to remind, that before wearing and after wearing mask, also we have to clean our hands as recommended. This is one point which we have to again remind, that cleaning the hands before wearing the mask and also cleaning the hand after opening of the mask is important. But also, mask for whom? As we have said, mask is only for those who have symptoms. If you have symptoms, you are going to a hospital or you are caring for another diseased person, then only you wear the mask.
Okay. Dr. Kaushik, let me bring you in on the mask bit. There is a lot of confusion. Who needs to wear the mask?
Everybody doesn't need the mask.
Okay.
People who have the symptoms like fever, cough, they need the mask so that they don't transmit the disease to the other people. Second, people who are like health personnels, who are working with the patients, who are working in the hospitals, who are seeing the regular patients, who are seeing the corona patients, they require the mask. Then further comes, there are two types of masks mainly. One is.
But before we go on to the kind of masks, you're saying health professionals who are dealing with corona cases need to wear, but say if I don't have fever, I don't have symptoms, I'm not coughing, I'm not sneezing,
then you don't require the mask.
I don't require mask.
Yeah.
But if I'm using a mass transit system like say the metro in Delhi, I don't know, you are a co-passenger, I don't know whether you're infected or not. Even perhaps you don't know whether you're infected or not. You don't have symptoms showing up, it will take 14 days to show. If I'm not wearing a mask, do I not risk contracting it from you?
Here comes the personal etiquettes, cough etiquettes, maintaining the distance. We should maintain distance of at least 1 meter or 3 feet between the two persons. If somebody is coughing, he should have the cough etiquettes. Either use the handkerchiefs, or if you don't have the handkerchiefs, you can use the shoulders for the coughing, but don't use your palms in your hands, because they will transmit. You will touch something else after coughing, they will transmit the infection to the other person also.
Dr. Talukdar, why aren't, say, if I want to take adequate protection, I want to be cautious, why shouldn't I wear the mask even if I'm not infected? Say if the other person is not following the etiquette, then I risk my life there, or it's something which I'm staring at, so why shouldn't I wear a mask?
Very, very valid question you have asked. See, what is happening is, if we wear the mask and believe we are being protected, what happens is we forget the actual protection which is going to save us. And if I am not infected, what is going to save me is, as I said, hand hygiene. The hygiene which is going to save us. See, a mask is not a foolproof guarantee that I will not get the disease. Please understand, mask is for me if I am having the disease, so that it does not go to the other people. Wearing a basic triple layer mask which we are supposed to wear is not a confirmatory tool that I will not get the disease. In fact, what might happen is, wearing a mask will feel falsely confident that, oh, now I am protected. Another issue with the mask is, this mask has a life of 6 to 8 hours. So please imagine that if I am wearing mask for 6 to 8 hours, we will have to again and again change the mask. And then the real people who would actually require the mask, there may be lack of mask there. Right? So those who need the mask, we should have the mask for them. And finally, the cost of the mask. If I don't require the mask, and if I am saying that you do wear the mask, then it is unnecessary expense. We're talking of the community here. So if you take these 3 points into account, we again come back to the first point. Yes.
All right, let's bring in another caller who's calling us from Chandigarh. Please go ahead and ask your question. Tell us what your name is and what your question is.
Sir, my name is Ranjana. I am from Chandigarh. Sir, I have 2 questions. The first question is that someone said that non-vegetarian food also spread coronavirus. And the second, I want to know, is it true? And second question is that how many times we should wash our hand, how frequently, because knowingly and unknowingly we touch so many things.
Right.
So,
All right.
Sir, I have, okay, sir.
All right. Good questions, Ranjana. Ranjana wants to know, Dr. Kaushik, whether she can have non-veg. If she does have non-veg, does she risk contracting coronavirus?
Non-veg can be taken. Condition it should be properly cooked and the source should be hygienic from where they are purchasing.
Does non-veg food contain coronavirus? Can it be a transmitter of coronavirus?
If the food is cooked properly, then it will not transmit the coronavirus. If it is incompletely cooked or the raw meat is there, non-veg is there are the chances.
There are chances. But compared to Dr. Talukdar, say a vegetarian food, if I'm not hygienically cooking my vegetarian food also, do I again run the risk of coronavirus as compared to non-veg? Could you clear the air on that?
Yeah, let me very crisply bring out this point. Food is not a mode of transmission of coronavirus. Corona would be spreading either through droplets or fomites. But then why do we all insist that yes, you can eat all non-veg food, but then cook it properly, wash it properly, is because there's so many other diseases which is transmitted by uncooked or improperly cooked food. That's why we insist that please do cook it properly with adequate temperature and also do wash it beforehand. But yes, coronavirus in India does not spread from non-veg food, as the question was.
All right. So let's clear the air on this. Let me repeat this at the risk of repeating myself, because a lot of people asked, a lot of callers have asked this question. Coronavirus does not spread through food. What spreads through food is, say, unhygienic food. It's not clean, it's not cooked properly, it's not cooked at the right temperature, is other diseases that you can get. So you can eat all kinds of food, but as both experts, Dr. Kaushik and Dr. Talukdar, were saying, be clear, be careful that you cook, you clean your food, it should be hygienic, and you cook it properly. Ranjana had another question. I think I've forgotten the other question that Ranjana had. Ranjana,
How many times
should she wash her hands?
There is no fixed numbers. Whenever they feel the hands are not clean, it can be washed.
Should she wash it every hour, 20 minutes?
No, it depends. If she is, it depends what kind of work she is involved in. If it is at home, if she feels the hands are not clean or they are infected, she can wash as many times as she feels comfortable.
All right. Dr. Talukdar, but if you were to put an average to a random person in the country who goes to work or stays at home or buys purchases from a shopping store, how many times, if we could average it out, should wash their hands to be careful?
It again depends on how much time she is coming out of the house, how much time she is contacting the outside world. But here I would like to insist on one fact that yes, if the hands are dirty, then it is not the hand rub which is recommended. This is another point I wanted to bring out. If our hands are visibly dirty, it is recommended that we definitely wash it with soap and water. Otherwise, both of them can be used. For soap and water, 40 seconds. For hand rubs, it is 20 seconds. But anytime she goes out, touches any in contact with anything which is potentially infectious, she should be cleaning her hands, and we've already discussed what is a potential infectious source.
All right. Dr. Kaushik, so basically, as both of you are saying, wash your hands, but there is no number. If you be careful about the surfaces you touch. Is there anything else that we need to tell our viewers this evening before we go into listening to what the Prime Minister has to say to the nation? In a little while, he'll be addressing the nation, that people need to be careful about.
I will say prevention is always better than cure. We should maintain the etiquettes, the hand hygienes, handshake. Namaste is better than the handshakes. We should maintain the distance of 1 meter in the outside. Unnecessary gatherings, unnecessary outgoing should be avoided if it is not necessary.
All right.
And hand hygiene is the most important.
Most important. Dr. Talukdar, before we close, you were wanting to tell us about the kind of masks that people should wear.
Yeah, again, see the expensive N95 mask, people are hoarding that, some people are rushing to buy that, is meant for a select group of medical professionals. Please, let's be careful, let's not rush for the N95 mask. What we may have to wear, and as I had already told before, is that if we are symptomatic, if we have symptom, if we are caring for somebody who has any of these suspected criteria for the disease, or if we are going to a hospital, then we should definitely wear the triple layer mask to protect ourselves and people around us, primarily to protect others.
Protect others.
And
So
another thing I would like to add, we are getting a lot of questions in society also. What people are doing, they are washing the mask and reusing them. They are disposable masks. Even the surgical masks.
do not wash them
and dispose them.
All right, that's all the time we have for Dr. Kaushik, Dr. Talukdar. Many thanks for being on the show. That's I hope this show was informative for you. We'll be running this show every day on DD India at 7:30 in the evening. Don't forget to tune in and call us if you have any queries. We'll have doctors sitting on the panel to answer all your questions. That's it for the moment. Thanks for watching. Namaskar.